So now we're going to talk about thoracic surgery. So thoracic surgery can be either supine or it can be lateral. Most often it's probably going to be lateral, but just be aware that you can do some thoracic type procedures in the supine area. Being that you're most often going to be lateral, of course positioning is going to be very important. You want to make sure that you do have all of your positioning equipment prior to positioning. You don't want to have to be running around looking for stuff or trying to get material when you're actually putting the patient in the position. So please make sure that you've gathered all your equipment, right? Your axillary roll, your airplane arm board holder, your pillows, the correct arm holder, or excuse me, head holder for your anesthesia provider. So make sure that you are have gotten all that ahead of time, that you know what your surgeon prefers as far as the axillary roll. What size is he like, or she? Where is it placed? Okay. If they have a particular lateral holder, if they're like a bean bag, you need to find out what they're going to be using. When you're working in the thoracic cavity, you're going to need long instruments. You need some big instruments. You will use some fine instruments, like you might have long fine right angles, but you might also have some long blunt right angles, because you're going to be dealing with some thickened tissue. You're dealing with lungs. You're dealing with bronchi. Okay, you're dealing with esophagus. So those are some thickened, sturdy type tissue. So not only do you need long instruments, you need fine instruments, and you also need some sturdy blunt instruments. So make sure that you have the right types of sets. You need a thoracic set, and you probably do need a long instrument tray. You're going to be dealing with ribs, right? Whether you're full straight on supine or whether you're on the side, you may have to remove some ribs. Now you're going to have the rib spreaders, right? That's your self-retaining retractor is a rib spreader, and there's different types of rib spreaders that you're going to need. You need rib cutters, okay, rib shears. Okay, there's different types of rib cutters, so make sure you have a variety of them in your thoracic set and be familiar with how to use them. You use rib strippers, right, to get some of that periosteum off of the ribs before you can actually cut the rib. And then there's different elevators that you need to start lifting that periosteum so you can get to the point where you can cut the rib. So know your instrumentation. Obviously, you're down there in the thoracic area. There's some important vasculature that you're going to have to be dealing with. Just like what we talked about in peripheral vascular. Make sure that you are careful with your needles. Make sure that you have your double-armed sutures. Now, you may have to have longer double-armed sutures than you use in the periphery, right? In the peripheral setting, you may have only had 18-inch double-armed double-arm sutures, but in the thoracic area you might need a 24 or a 36-inch suture, because you're going to have to go down in a long or in a deep hole to sew that vessel. Okay, so you need long, fine needle holders. Okay, so you need to be aware that you need to make sure you have the correct instrumentation before you get into a bad situation. Okay. You're going to be doing lung clamps, or you're going to be doing lungs, working around lungs sometimes. So make sure that you know how to manage, whether it's a bulla or a blab or a resurfacing, or if you're dealing with pleura, you need to know what exactly are you doing. Has the chest collapsed? You need to reinflate the chest. Do you need to have a what kind of tube is the anesthesia provider working with? Not that you have to get it, but be prepared. Is he going to be clamping off so that only one lung is ventilated while you're working on the other lung? Okay, sutures on the lung. You may have to suture the lung. You're always going to have chest tubes afterwards, right? To either for air escape, or to reinflate the lung, and for blood evacuation. Okay, so make sure that you are aware of what kind of chest tubes. Do they want a straight chest tube or a right angle chest tube, and that you have the different sizes available, and that you know how to get that chest tube in there. And then how are you going to secure it? Are you using a nylon or some other type of suture to keep that chest tube in place? Rib wires. You may need some wires for a cerclage for the rib, or you may just need some rib stitches for the for the tissues. Okay, so you may actually need wire sutures, or you may need wire for a cerclage, or you may just need those thickened, sturdy sutures to put that rib cage back together. What else can I say about that? That's probably all for thoracic. I'm going to go ahead and we'll talk about cardiac in the next segment.